Bismillahirrahmanirrahim. Assalamu alaikum, viewers, subscribers. Today I am going to perform malaria rapid diagnostic test. There is a strip in my hand. Before the discussion, and there is a request to subscribe my channel and click bell icon also for all notifications. Let's see how malaria RDTs means rapid diagnostic test work. Malaria rapid diagnostic test assist in the diagnosis of malaria by providing evidence of the presence of malaria parasite in human blood. RDTs are an alternative to diagnose based on clinical ground or microscopy, particularly where good quality microscopy services cannot be really provided. Variations occur between products such as targets and formats, though the principle of the test are similar. Malaria RDTs detect specific antigens, proteins produced by malaria parasite in the blood of infection individuals. Some RDTs can detect only one species, uh, one of them Plasmodium falciparum or Plasmodium vivax, while others detect multiple cases: parasite falciparum, parasite vivax, parasite malaria, and parasite ovale. Blood for the test is commonly obtained from a finger prick. RDTs are lateral flow immunochromatography antigen detecting test, which rely on the capture of dye-labeled antibodies to produce a visible band on a strip of intracellulose, often encased in plastic housing, referred to as casers. With malaria RDTs, the dye-labeled antibodies first binds to a parasite antigen and the resultant complex is captured on the strip by a band of bound antibodies forming a visible line, T test line. In the result window, a control line, C control line, gives information on the integrity of antibody dye conjugate but does not confirm the ability to detect parasite antigen. On this device you can see the points. There is a C point for control test, PF for parasite falciparum, PV for parasite vivax. As for sample whole blood or serum plasma, there is sample buffer, and you see the label malaria parasite PFPV. Inside the cassette is a strip made of filter paper and nitrocellulose. Typically, a drop of blood is added to the RDT through one hole, a sample well, and then a number of drops of buffer using through another hole. There is labeled as B buffer well. Buffer carries the blood along the length of the RDTs. Let's describe mode of action of common malaria RDTs format. First of all, the first step of the test procedure involves mixing the patient blood with a lysing agent in a test strip or well. They rupture the red blood cells, releasing more parasite proteins. Number two, dye-labeled antibodies specific for target antigen is present on the lower end of nitrocellular cellulose strip or in a plastic well provided the strip. Antibody also specific for the target antigen is bound to the strip in a thin line. Either antibody is specific for the labeled antibody or antigen is bound at the control line. Number 3, blood and buffer which have been placed on step or in the well are mixed with labeled antibody and are drawn up the step across the line of bound antibodies. Number 4, if antigen is present, some labeled antibody antigen complex will be trapped and accumulate on the test line. Excess labeled antibody is trapped and accumulates on the control line. A visible control line indicates the labeled antibodies has traversed the full length of the step past the test line and that at least some free antibody remain conjugated on the dye and that some of the capturing properties of the antibodies remaining intact. Number 5, the intensity of the best band will vary with the amount of antigen present. At least a low parasite densities antigen concentration, as this will determine the amount of dye particle which will accumulate on the line. The control band intensity may decrease at higher parasite densities as much of the labeled antibody will have been captured by the test band before reaching the control. The role of RDTs in malaria control. Malaria rapid diagnostic test can assist in making a rapid, accurate diagnosis of malaria in circumstances where microscopy-based diagnosis may be not available or unreliable. To enable effective diagnosis of all malaria cases, the diagnostic method used must be accurate and available at the point of care. RDTs may be useful. Point 1, diagnosis by health workers distant from good microscopy services. Remote diagnosis in organized workforces entering malaria endemic areas. Outbreak investigation and survey of the parasite prevalence. RDTs can offer significant benefits in malaria management if, number 1, a clear plan of action has been prepared to deal with the outcomes. A clear benefit is demonstrated in health outcomes. They are affordable and there are adequate systems in place to ensure RDTs are used correctly and are in good conditions. Next, use of malaria RDTs in clinical management. The following issues are important for successful incorporation of RDTs into malaria control. Number 1, clear benefits is obtained by the parasitological confirmation of malaria diagnosis. Accuracy of the RDTs can be regularly monitored. A cool chain is in place for transport, the storage. Good health worker training, supervision, and monitoring is in place. A clear policy of action on results in place. These elements must be allowed for in the RTT's budget. Next discuss we accuracy of result. RDTs should be sensitive enough to reliably detect malaria parasite at densities associated with diseases. Sensitivity is determined by the quality of manufacture, species, number, viability, and train of parasite presence, condition of the RDTs, technique and care used in performing the test, well as readers' interpretations. Sensitivity will always depend on the concentration of target antigen present and will therefore vary with parasite destiny. The same test may achieve at a high sensitivity in a population in which all infected people have a higher parasite density, above 10,000 parasite per microliter, but achieve low sensitivity in area where parasite densities are frequently below 200 parasite per microliter. Therefore, sensitivity stated may manufacture based on field trials can only be integrated if the parasite density of the study population is known. After the completion of demonstration of the test, this device has resulted negative because there is not any uh, line show any other point. So the material is here. You also see the material uh, according to it provide procedure, and then there is some devices conditions of the results. Invalid, positive or negative conditions are here. Thank you very much to see all the video, and if you do not subscribe my channel, please subscribe my channel and click bell icon for all new videos notifications. Thank you very much. Take care of yourself. Allah Hafiz.